so we have some psychologists who have been involved in conversations with the VA and with APA, and I would love for them to speak to all of us and to begin their relationship with Lawrence. So we have Dr. Alexander Kraft, Dr. Judy Steinman, and Dr. Elaine Levine. Alexander, if you would go first as a civilian working in a military setting and as a prescribing psychologist. You've had so many frustrating experiences with even prescribing in the military, and then, of course, having difficulty prescribing in the VA.
Yeah.
Thank you.
Yeah.
Thank you so much for being here,
Thank
all the way from El Paso, Texas.
I recently left Madigan Army Medical Center to return to the VA. While at Madigan Army Medical Center, I was a prescribing psychologist. I had the honor and privilege to work with Dr. Scheer, who I know is sad to see me leave in any event. So I have been a prescriber in private practice as well. And returning to the VA, I have become very passionate and observant about the fact that the VA, those who make policy, those who write directives on taxpayer money to prevent psychologists from practicing in the VA, there's a simple blurb in a directive, which is a policy like law, that states that psychologists, unlike other professions who have state licensure to practice psychopharmacology, are prohibited from practicing, period. It is a short paragraph, and that is cited within the VA as the reason why psychologists ought not to be practicing, despite the repetitive reports from OIG way back then to current that psychologists, psychiatrists are in short supply. OIG's report, 2022, fiscal year 2022, states that the improvements that have been made in recruiting mental health professionals and other professions in medical care have had a bit of a setback. 71 plus facilities in the VA footprint have a severe, quote unquote, severe shortage in psychiatrists. That does not include nurse practitioners or PAs that specialize in psychiatry. 91 plus facilities across the footprint have shortages of nurses. Nurses, as you know, support our physicians and psychiatrists, triaging, vitaling, and such support functions. And we also have shortage of psychotherapists. That is true. I recently got a comment from the VA Director of Public Policy. She's the Director of Public Policy. When I asked her if she has any documents or references I can cite that state to the fact why psychologists are prohibited, aside from the directive that I know exists, she said, well, she left that blank, but she said that psychologists, it is not the plan of the VA to have psychologists prescribing. She did not cite a white paper or a plan that is in the public domain that can be reviewed. Also, she said there's only 5 states that allow psychologists prescribing. And a few other comments she made that were incorrect. I didn't get into it, but I thanked her for her time. So this is a taxpayer-paid federal official who makes public policy that affects thousands of veterans. And working in the VA, every day I sit there, I work in a primary care clinic with physicians and PAs, and even if I see there is an error in prescribing, and there are occasional errors, I am not permitted, per my management leadership in the VA Houston, to discuss that with the physician. I have to tell a pharmacist, who then can intervene and tell the physician. Now, I have a good rapport with the doctors, a general family practitioner, a PA, and another physician family practitioner as well rely on me. And I, probably a bit past my purview, make some recommendations, but I have to be careful so I don't get written up by the leadership in any event. So I'm a prescribing psychologist, independent prescriber. I am prohibited from sharing my knowledge. And I have veterans in front of me that share their plight that I know from listening to what they're telling me. And as I provide brief interventions, psychotherapeutic interventions, telling me that I have problems with medications, having remained on a medication for the past 5 years that's just a 25 milligram starter dose, those kinds of simple things where I could intervene, I have to speak in a legally non-binding way to the provider and tell them, there's a screw up here. Please fix it. The patient is suffering. So veterans are suffering because of the VA. Veterans are not getting the service fully and completely in a safe manner that could be enhanced with allowing prescriptive authority to psychologists. I think I overstayed my time, but thank you for listening.
No, we appreciate
Yes.
that. I mean, you
Yeah.
talk about the frustrations and you talk about the conversations, and some people are supportive and then others aren't. And it feels sometimes like you're just banging your head against the wall. And
Yes.
and you're a prescribing psychologist,
Yes.
licensed in New Mexico, right?
Yes.
Yeah.
Yes, correct.
yeah.
I'm licensed in.
So there's no reason why he shouldn't be able to prescribe. No. All right.
Yeah.
Thank you so much.
Thank you all for
Dr.
listening.
Kraft.